So turn to your neighbor and tell them whether they snore at night. Ask them whether they snore at night.
I've never heard of that. Turn to your neighbor. That's new.
Yeah? You know, the thing is, would you know when you're snoring?
That's the thing.
Unless somebody says.
So have you been told that you snore? All right? Is snoring okay or is it not okay? Apparently, snoring, apart from just being a noisy neighbor, snoring also could have health implications and some very serious ones. ENT surgeon Dr. Ian Macharia is our guest and he'll walk us through that. Good morning, Dr.
Asante sana. Thank you for having me, guys.
Karibu sana. You're very lucky because Jano is going to give you the day's quote. And today's quote, she's not quoting Janet.
Not yet.
Not yet.
Not yet.
Yeah, it's her penultimate show.
Yes.
She has been on Fixing the Nation for a whole year and she's doing the final lap. You anachukua relay.
Oh,
Yeah.
I'm blessed to have
Ametuambia leo
you
asubuhi.
with you today.
Yeah.
Thank you. Senator Busia Okia Omtata said on Fixing the Nation, he said, the new name of peace is development. Yeah. What do you make of that?
Okay. Peace is not just absence of violence. Peace is an active process.
Crockett.
I know.
Just immediate. Crockett.
Yeah.
Yes.
And the reason I say that is because it also blends in with what we're talking about today. People think that sleep is just, you go to sleep, block in and wake up. But sleep is an active process. Your brain actually takes energy to sleep. And when it's disrupted, then you get a lot of problems. And that's what we're talking about, snoring and sleep apnea. Yeah.
Okay.
Let's first, what is snoring?
Okay.
You know, let's just be very clear what snoring is.
Eric, before we make assumptions,
Before we make assumptions.
let's have the expert tell us.
Okay, actually, it's so good that you've asked that question because a lot of people make assumptions. There are many sounds that are produced at night, okay? For those who've been parents, who've had children with asthma, a wheezing sound, stuff like that. For those who've had teenagers grinding or like groaning, not snoring. Snoring is a sound that you produce when you sleep. And why do you produce it? When we sleep, your airway narrows, okay? Your muscles relax. And when air is being pushed through this narrow airway, it vibrates, giving you snoring. So snoring is a sound.
Okay.
Yeah.
Does it always happen?
No.
So you've said when you sleep, your muscles relax.
Your muscles, your throat muscles relax.
Your throat
yes.
muscles relax. Does everybody's throat muscles relax when they sleep?
No, actually, it's when you look at the numbers, about maybe 20% of men and about 10% of women snore. So not everyone does. So it's a significant number when you look at the global population. If you think about 50 million Kenyans, that's 20% of men. And we also have to be very careful because they're occasional snorers. So we're not worried about the occasional snorer. If an occasional snorer is 1 to 2 times a week, we're not worried about you. You're a simple snorer. What we're worried about is the persistent snorer. That is more than 3 times in a week.
Why does it show up more in men?
Well, number one, we do know that the fat distribution of men is different from women. Okay? So men distribute their fat a bit around their neck. Number 2, genetics. Number 3, hormones. There's a hormone that women have that protects them. Unfortunately, that protection leaves after menopause. But women are not are very silent about it. But the numbers sort of equalize after menopause,
What is
unfortunately.
this, estrogen?
No, progesterone.
Why would I guess estrogen?
No, those are 2 significant hormones in women.
But
yes,
progesterone
progesterone is
definitely
the one that
makes more
protects women. Yes.
Okay, protects women in what sense now? From the muscles relaxing?
From the muscles relaxation. You get so remember what I keep on saying. There's muscle relaxation and there's airflow and vibration. So that hormone protects women and also the fat distribution as well. So that really goes on the side of women.
And then the factors that cause snoring, talk to us about that. Is it something that people inherit or is it something that people are born with?
Okay, so there are a couple of things. Number one, your throat, think about your throat as having real estate. Space matters. So when you have a narrowed throat, what that means, you have enlarged tonsils. If you're a child or you have enlarged adenoids, you have a large soft palate, that narrows the airway. That's number one. Other factors, we talk about obesity. Okay, that's usually the typical patient that you think about who snores. The large, obese, elderly man. Age. And why age? The throat is basically a tube of muscles. And that tube of muscles, the tone reduces as we age, unfortunately. So that's why elderly people snore more. Another thing is sedatives. And the most likely sedative is alcohol. So you'll find we call them bed partners. Your bed partner is going to complain after a night out on Friday or Saturday or even Sunday as well. Or other types of sedatives. And then gravity. For those who slept with snorers, you know when they sleep on their back, it gets worse. And we call this elbow therapy. You're nudged a bit.
Elbow
So you go to the side, it gets much better, and then goes back. So what we get worried about is not just the sound, but actually the disease that comes with it, which is called obstructive sleep apnea.
Which we'll get into. What about exhaustion? Is that also a factor?
Yes.
Yeah.
So you will actually notice, and a lot of patients tell me this, that when they are much more tired, they snore more. Yes.
Okay. Wow.
So you were talking now about obstructive sleep apnea. So when does it move from snoring to obstructive sleep apnea?
So when you think about snoring, you always think about sound. Okay? It's a sound.
Yeah.
Obstructive sleep apnea, the disease, what we are worried about is the silence. So remember what I've just talked about? Your throat narrows down. Your throat that's partial blockage. It can narrow down and block off. And you stop breathing. That is what is called obstructive sleep apnea. An obstruction of your airway that causes you to stop breathing. And if you've ever slept with a snorer, it's the silence that actually scares you. Because that silence is, you feel like they're snoring and then they stop breathing and then they wake and then they have gasping or they have choking. And that's your brain rescuing you from low oxygen levels. And even worse is that you have microarousals. And a microarousal is that your brain, actually, you go through this dozens or even hundreds of times in a night, and you're not able to go down into restorative sleep. So you can imagine, remember I said sleep is an active process. You go from stage 1 down to stage 2, down to stage 3 where the magic happens, and then you go into dream sleep, what is called REM, and then you repeat that process, usually about 4 to 5 times. If you're not able to go down into the depth of your sleep, you don't get the magic of sleep. You don't get restored. And patients with obstructive sleep apnea talk about their nighttime symptoms. That's what bed partners complain about. But you yourself will complain about daytime symptoms. And I'm sure we're going to go through that.
Just wait. I know we're still threading on apnea. This thing of where the magic happens, what does that mean in terms of...
And what is the magic?
What is the magic?
So,
In terms of the cycles of sleep.
The cycles of sleep, yeah.
So we have stage 1, 2, 3, and then dream sleep, which is called REM. There are many functions of sleep. I mean, we go through this every night. So there must be a reason why we sleep. Part of the reason is we restore our mental health. So actually all the brain, chemicals that have accumulated through the day get washed away during sleep. Okay, so that's number 1. And we know that you're tired, you go to sleep, you wake up, you feel fresh. Fantastic. Your muscles are as well. How your body works is that it accumulates chemicals and then washes them out at night. So your brain accumulates chemicals, your brain health. Your body accumulates chemicals, washed away. Also, your mental health as well. Remember, we used to be told if you have if you have, our grandmothers used to say, if you have something that you're worried about, sleep on it. Why? Well, unfortunately, science doesn't know. But you feel better. Your brain organizes it. We don't know how it happens.
Right.
And then but it happens. And then finally, the function of dreaming. We don't know what dreaming, why we dream, but it does help.
Yeah,
Yes.
or who writes the script?
Who writes the scripts?
in
Yeah.
the dream.
But where's the magic?
So all
What is the
that-
stage of magic that some
all
people...
that-
So stages 1, 2, 3.
So stage 1 is the entry point of sleep.
Right.
Can I
Okay.
pose it? Sorry, before you go into that, can I pose why we dream? There's a lot going on.
Yeah.
There's a lot going on,
Any
yes.
given time.
Yes.
That needs to be processed. And it's being processed in the present. But like you said, if it's a restorative time, then it's also time for the brain to process all it's seen, heard, smelled, from the time you were born to now. I'm assuming that's usually what's happening. Just like a
It's like a montage
like a montage.
Yes.
of
Yeah.
sorts.
Yes, it is.
Yeah.
We don't have many dream scientists globally.
Yes.
So for those who are interested in sleep science and dream science,
Go
there are
into
very few global experts in this.
Okay.
Yes.
Okay, but go on. Yeah.
Yeah. So stage one is entry point. Okay, you can easily wake up. Stage 2, your body relaxes. You'll feel if we measure it, you'll find your heart rate goes down. Your body temperature dips a bit. Your body is relaxing. Stage 3 is where a lot of the chemicals are worn off, and which is dream sleep or REM sleep, your entire body relaxes and you dream, and then you go back into. So all those little stages are super important. And if you don't go down into sleep, down into the depths of sleep, then you don't get restored. Yeah.
So what you're saying is during this moment of snoring and then you get the obstructive sleep apnea, you stop breathing, your brain panics and forces you to wake up. So maybe you're on cut just before the magic. And then brain no oxygen, brain forces you to wake up. So you go back to the beginning.
Yes.
You always keep going back to the beginning.
And you can imagine
Yeah.
that happens dozens, or even hundreds of times. And when we
Can
test,
the brain
we
give
can
up?
see.
Can it say,
No.
kama utaki kunipatia oxygen?
Actually, that's the beauty of the human body. Patients are very worried. They ask, can my brain give up? And I tell them, your brain will not give up on you. So that is a reaction, and that's what gives you all those micro-arousals. And that's why you keep on waking up. I've got patients, when we do the testing, it can happen actually even up to 100 times in an hour.
What?
It's crazy. It's crazy, the numbers that we see. But we'll talk about that during testing.
Okay.
Yeah, because we can test these things.
So then your body, okay, so that means you're not getting, like you said, proper sleep, you're not getting rest, you're not restoring. Do you notice, or is this something, because is it your mind can wake up, no, but I don't know if that makes sense. Or is it actually waking up like a little bit, 100
Micro-arousal.
times?
So when you think about nighttime, so I'll talk about night and day, because this will answer the question, how do you know you have this problem? Okay. So nighttime, of course, it'll be snoring. So there's a sound, and then there's the silence, the gasping, the choking, and then a micro-arousal. And for a lot of patients, they don't know they've woken up. Okay, it's a micro-arousal. For some patients, they actually wake up and they feel, I need to go pee. And you'll notice that elderly patients, yes, there are many reasons why people wake up to go pee.
Yeah.
One of them is sleep apnea. It's not just that you have a large prostate or you've taken a lot of water or something like that, or it could be sleep apnea.
Okay.
So those are the nighttime symptoms. Okay, and I think that is pretty clear.
Yeah.
But there are daytime consequences of not going down into sleep. You wake up feeling unrefreshed. That is very obvious. You wake up having morning headaches that clear up. Okay, you're not getting enough oxygen. You wake up feeling tired. You wake up having what is called EDS, excessive daytime sleepiness, where you're a driver and you feel like dozing off. You're a computer guy, you work in front of your laptop, you're dozing off. And you can imagine you're a driver, you're a pilot, what we call mission critical workers.
Yes.
Okay.
You can't sleep.
MCWs, mission critical workers. We see them in the clinic, and obstructive sleep apnea is a hazard for them. So that answers your question. How do I know? Usually it's daytime symptoms. How does your partner know? Maybe it's nighttime symptoms. The biggest challenge are those who sleep alone. And a lot of people don't have bedtime partners. Okay, yes, yeah. So how do they discover that they have obstructive sleep apnea?
Yes.
Maybe you go to your friend's house, you go to a relative's house, you doze, you're told, hey, Buana, you're really snoring. Or we're actually worried you're gasping. We've been nudging you and stuff like that, you know. And then the third category are those who absolutely have no idea or have been ignoring. So you go to your doctor, you have uncontrolled hypertension. So now I think that goes into the consequences. Because why should we care?
Right.
Is snoring a nuisance? Or is it a danger?
Right.
So for those who it's a danger, you get uncontrolled hypertension. We've got patients who've been referred to us, guys, who are on 3-4 antihypertensives. The doc is, you have a fantastic doctor. They're on the top of the game. They're giving you the latest medication. It's just not being controlled. You have, and that's because of, hypoxemia. You've got diabetic patients who have uncontrolled diabetes. Of course, what I'm saying is that there are other reasons, but there's a reason that we have that is called obstructive sleep apnea that can be sorted out. You have mental fatigue. You can't concentrate. You feel like I used to be sharper than I was. You're irritable. Now remember because
He literally laughed and looked.
How you reacted to that? Like, yeah.
I think after this, Eric and I will sidebar, be like, is there something you'd like to say?
Yeah,
Sorry about that.
yeah, and that is very significant because remember what I said, it levels out after menopause. The problem with obstructive sleep apnea is that it looks different in men than in women.
Right.
In men, it's very classic. We know those classic, I don't even need to tell you, snoring, sleep apnea and all that stuff. But in women, postmenopausal, how does it present? Irritable, bad mood. You have this, what we call psychosomatic. You feel neck pain, shoulder pain. You have facial pain. Okay, not really headache, but facial pain, You're getting...
Uso yako inauma.
We call it facial pain, And those are some of
Eric
the
is
symptoms.
lost. Is stuck at unaumwa na uso aje. Yeah.
Hospitali ni nini imekuleta leo?
Unaumwa na uso. The reason is that headaches most people complain about. Here you feel like you feel it at the front. Yes, yeah. So those
You feel
are
like
some of,
at the cheekbones.
you feel it
and
at the
eyes
cheekbones,
and
yes, and you can some of them talk about other reasons, but a lot of it is obstructive sleep apnea. And then we've not even talked about children. Because children is a totally different animal.
Social jet lag. Explain what that is and how it also plays in.
Okay. So when you look at sleep, there are about 7 different conditions that affect sleep. The first one we all know, insomnia. That's a biggest one, and we're not going to talk about that. The second one is sleep apnea, obstructive sleep apnea. That's what we're talking about right now. The third one is circadian rhythm disorders, okay? And then the fourth, that now what you're talking about is jet lag. We are moving between time zones. So that's a big deal, especially in the aviation industry. So that is new, about maybe 100 years old in terms of sleep disorders. Yes, yeah. And usually physicians are the ones, or aviation experts are the ones who deal with that.
Okay, the one I had heard about is social, which is, it's almost the same feeling you get when you're jet lagged, but it's like a cycle of exhaustion. That's why I was saying social.
The biggest problem with a lot of sleep disorders is that you're going to have common symptoms.
Okay.
Because as long as I'm disrupting your sleep, I'm going to have some common symptoms. Okay. Yeah.
Okay.
And then I also have some unique symptoms. So you'll never have a patient with insomnia talking about, maybe snoring.
Yeah.
Okay. Usually those are very different. Yeah.
Among the things that you talked about, like you said, there's snoring, there's wheezing, and all these others. So if somebody, for example, is asthmatic, are they more prone to having these obstructions in their sleep? If somebody has, say, problems with their sinuses, something on their nose area, can it affect the throat area?
In their ENT
And the
area.
ENT area, yes,
Specialists.
yeah. So you've actually hit the money ball because snoring and obstructive sleep apnea is an upper airway problem. Wheezing and asthma is a lower airway problem. So half of your question is actually correct, where nose problems. You've been knocked about, used to play hockey, used to maybe be a boxer or something like that. You have a crooked nose, deviated septum. You have large polyps inside your nose. You have turbinates. So all these things are inside your nose, just basically blocking the airway. And for anyone who's an engineer or a pilot, you know about turbulence and some of the physics, Bernoulli's phenomenon. Am I bringing some?
But Bernoulli's
Bernoulli's principle.
Bernoulli's principle.
Okay.
Bernoulli's.
I've heard of it, but I can't remember what it was.
But basically, blockage in your upper airway causes collapse in your, in your throat.
Okay.
So you're very right.
Okay. We actually have just hit a good time to go into a break and also just find out, I guess, what are the signs that you have this, a little bit on children, because I think there's a lot of people watching who are wondering if my 7, 8, 9, 10-year-old is snoring, when should I be worried, when shouldn't I? And of course, medicine, what it's doing to help with that. We're in studio with Dr. Ian Macharia, an ENT surgeon, when snoring is a signal of health risks. That's the conversation. It's coming up to 7:30. We'll be back after this.
62.
Absolutely. We're going back into our discussion in a moment of when snoring is a signal of health risks. Some feedback we have here. Let me see. We have Kagori. This is on YouTube. Should the anti-snoring devices be prescribed? So in a while, Dr. will walk us through exactly what's happening now in terms of just the breakthroughs and medication and devices. Then again, he also asks, what key warning signs should one look out for to distinguish between harmless snoring from a serious condition like obstructive sleep apnea? I think that was mentioned a little bit. Sylvester Dyer says, Eric, is it true if you copy someone snoring, then you might start snoring too? And then ask Jeremy.
It's like you're mocking someone.
It's like you're mocking somebody, then it ends up being you.
Yeah,
and then finally ask Jeremy, is asking, I never snore. Am I okay? Is he okay, doc?
Is he okay?
Is he
should
fine?
be okay.
He's
He should
fine.
be fine.
How does he know he never snores?
He's never been
He's been
told.
told by the bed
partner.
partners.
Maybe they're just being nice and polite.
Well,
You should ask.
you can record yourself. Do an 8-hour audio recording.
There are actually
good.
apps for this now.
That's
Yeah.
good.
There are
Oh,
apps
yes.
that actually you just turn it on and then it'll pick all those sounds and break them down for you. At this time, you snored. At this time, you coughed.
When you track sleep quality, yeah?
Yeah.
That's
Okay.
good.
Yeah.
I know that we're coming back into the treatment. Talk a little bit about how it presents in children.
Okay, so, children are different from adults. What happens with children is that they have these two organs. One is called tonsils, which are inside the throat. And other ones are called adenoids, which are the back of the nose. It's a physical blockage. They usually grow large as the children grow and the immunity becomes better. And what happens is that they physically block the upper airway, causing snoring, sleep apnea. And for some of them, you'll find that their school attendance is poor. They get recurrent infections, and especially because they're in tune with other kids as well.
Right.
What do we do about them? Usually 3 things. Either we allow nature to do its work and they resolute by themselves. We give medications, antihistamines, nasal steroids, nasal sprays, or we take them to theater and actually remove the obstruction, and that clears up, and it's fantastic.
Okay.
Is this what used to be, when you were kids, so many people used to get their tonsils taken out. Was that the reason?
Usually we remove them for 2 reasons.
Okay.
Either they are large, causing physical blockage, giving you snoring and sleep apnea,
Right.
or they get recurrent infections. So then we remove them. Usually those are the 2 big reasons we remove them.
Okay.
Yeah.
Okay. Is there... was it necessary? I don't know why. I'm just thinking, So many
remove
people
the
used to get
tonsils.
their tonsils taken out, and I'm
Yeah,
like,
the tonsils.
ish.
There's a thing called like a small tongue.
Like a small tongue, yeah.
At the back of the
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 kirimi.
uvula.
Yeah,
Is that what
or the
it's called?
kirimi, yes,
Yes.
yeah.
Kirimi, okay.
Yeah. But is the surgery necessary? Yes, because it's disrupting their sleep, and our grandmothers were actually correct. Children grow during sleep. Growth hormone is produced at night, so children need actually much better sleep than adults. Okay, that's why they sleep much more. Their brain quality, the quality of the sleep impacts their brain health, as well as their heart health and their lung health. So that's why we remove them. So some people asking, why is it more common now? Of course, we have more doctors, we have better testing methods, and also some of these things are just more prevalent. What you just said, Eric, a lot of people, I can see, some of you guys are wearing smartwatches. Some of you guys have apps on your phone. And then we have this wonderful thing called Google or AI, ChatGPT, where you talk. I get a lot of patients who have Googled their symptoms who have gone on ChatGPT asking, and they come and say, hey, doc, my AI has told me this is the problem. Is that true? What do I need to do about it? How can we test? Can we treat it? Yeah.
Okay. Side note, how do you feel about that? It used to be, I sneezed and then it told me
Google told me.
my brain is about to explode. Hey, doc, now it's AI. How do you feel about people coming with AI diagnosis?
There are two types of patients. AI diagnosis can give you anxiety, or it can lead you down the right pathway. My work is to be able to alleviate your anxiety and test and treat your problem. So I'm an AI lover, and I think AI is going to shape medicine differently. Maybe in the next 50 years, medicine as we know it is going to change. And I think that's a totally different conversation. We should all have AI committees in our hospitals, just the way we have theater users committees or accident and casualty committees. We should all have AI committees in our hospitals, because it's going to come and change our facilities.
Really?
Yeah.
That's
Really?
progressive.
Yeah, we should.
We're going to testing shortly, because you talked about the things that you do to test. But before that, even in the article that you wrote, you said this snoring, obstructive sleep apnea, has an effect on your heart. What's that effect?
Yes. So when you stop breathing, your oxygen levels go down. That happens repeatedly, cumulatively. What does your heart do? Starts pumping harder. Well, some people say, hey, my heart is doing cardio for itself. My question is, how long can that happen for? And what happens with the body? It compensates until it can't compensate anymore. So that's why it becomes a problem. Yeah.
So can the heart stop? So your brain won't stop.
So
Can the
unfortunately,
heart get to a point where it's like, unanifanyisha kazi mingi?
unfortunately, yes. Unfortunately, yes.
I was kidding.
No. Yeah.
For real?
Yeah. Well, you can get strokes. We call them lethal cardiac events. We have a nice name for everything. So a lethal cardiac event can occur because of obstructive sleep apnea.
This is serious. So now how do we test?
So,
Beyond the sleeping partner telling you things.
or even your watch as well. Remember, we're into the age of AI and wearables. You come in, the doctor does a history and physical examination. We sometimes put a scope, to assess your airway, what is called a flexible nasopharyngoscopy. But how do we test? Can we test your sleep? The answer is yes. What we are called sleep studies. Okay, so we have them at the Sleep Diagnostic and Treatment Center.
Okay.
That's the Nairobi Sleep Diagnostic Treatment Center, and we do sleep studies there. And what are we checking? We're checking your brain patterns. We're checking your breathing patterns. We're checking your oxygen patterns. We're checking your movement as well. And all that information gives us a beautiful number called AHI. Remember I said you can stop breathing dozens or hundreds of times? That number, AHI, is one that tells us. Okay. So there's a device that you either take home or do it at the sleep center, and it gives us this number. Anything less than 5 is normal. Anything above 30 is severe, and then we go from mild, moderate to severe. So that's how we test it.
Okay. Whoa. Even outside of snoring, so you said anything below 5 is
It's normal. Yes, yeah.
So if you stop breathing 5 times in a night, That's like
We say that is normal. We say that is normal.
Interesting.
Okay, yeah. Less than 5 is normal. Yeah. Because the body doesn't give you 0. There's hardly anything gives you 0, okay? But anything less than that we say, because we have to have a cutoff.
Right.
That's how science works. There has to be a cutoff to say this is abnormal and this is normal.
Okay.
Yeah.
How do you do that? You make me sleep.
Yeah, no, I don't make you sleep. You sleep by yourself.
So I come to the facility,
You come to the
and
facility.
just because I've seen you, I'll sleep.
So
What if I'm wide awake?
yeah, so those are some of
I'm
the
coming to you
difficulties.
during the day, doc.
Oh, no. It's a nighttime thing. So it's a nighttime thing, yes. It's a sleep study. So so it's done at night. Okay. So there are different
And
ways
then you
to
connect all these probes on me.
No, not. So we
With those things that are making me not sleep well.
So that's we connect gadgets.
Yeah.
Okay. Of course, you can already see some people have what is called first night effect, where you have difficulty sleeping in a new
place.
space,
Yeah.
new environment. You have some gadgets around you.
And you know you're being monitored.
And you know you're being monitored.
Yeah.
That anxiety comes with it. It's called first night effect. Okay. So we expect, and when we check your sleep, we actually expect maybe 85% efficiency of sleep. So we know it's going to be a bit difficult, but that's what we have medically. Okay, medical legally. We do know that there are other devices. A lot of guys come, hey, can you check with my sleep watch? It tests, but it's not medical legal. So I can't use that as a legal device to assess your sleep. Okay. And that's a legal
But it's
problem.
a good indicator.
It's a good indicator. It's fantastic. It tells me a lot. Okay. So that's the sleep study. As a surgeon, I can also make you sleep and check where the obstruction is from, what is called DISE, drug-induced sleep endoscopy. I take you to theater, give you a bit of medication, not me, the anesthetist, take you down to sleep levels, not anesthesia, just to sleep levels, and put the endoscope, what we call the flexible endoscope. So that's for ENTs. And we observe and see you sleep and where the obstruction is coming from. And that gives us, remember, I'm sure we're going to go to testing, but that gives me a surgical diagnosis that I can treat, what is called precision medicine. I don't know if you guys have seen that. It's a buzzword, but buzzwords are in reality. So precision, one of the specialties that does precision medicine is ENT surgery, and especially sleep surgery, where we look where exactly is the problem and sort it out. And we're blessed to be able to do that for our patients.
What is sorting it out?
So sorting it out, man, they're very different things. And it's layered. Step 1, conservative. Remember what I talked about? Number 1, we ask patients sometimes lose a bit of weight. Okay. Sleep hygiene. Reduce your alcohol.
What is sleep hygiene?
Oh, sleep hygiene is this big monster that we tell patients try and get the environment and the mood to sleep better. Okay, so there's some people get right of work and try to sleep immediately. That's not possible. Your brain has to
You need a wind down.
Exactly. We have big words for everything. It's called winding down. It's called winding down. So that's the medical bit of it. Okay. So that's one of the things, okay? So lose weight 10%, reduce your alcohol. We say if you're going to take alcohol at least 4 hours before you sleep, okay? And also try not to sleep on your back. There's an old school trick. Remember I said you get nudged because gravity is collapsing your throat? There's an old school trick. You put a tennis ball at the back of your T-shirt. That makes it more uncomfortable. So you sleep on your side. Or have a wedge pillow. So those are conservative ways.
Okay.
There's somebody who asked about nasal devices. That's if you have nasal obstruction, especially the ones who have collapsed noses. So you just get that device. You've seen them somewhere.
Yeah, it looks like a mask, like a breathing mask.
No.
Oh, it's a different one.
This is just a strip.
Oh, the clip. Yes.
Yes.
Yeah, I've seen that as well.
So that's step 1.
Okay.
That's step 1 of treatment. Step 2 is what we call the gold standard, which is called CPAP. So a CPAP is a device that blows a steady stream of air to keep your airway is collapsed. It's repeatedly collapsing. So it just keeps your airway open. Okay, that's CPAP. devices, dental devices, what we call MADs. So you have to have a sleep-aligned dentist. So not all dentists are good at this. So we have to work with dentists who know what they're doing, and there are very few in this country. And that's what I'm saying, that sleep is not...
dentists who know what they're doing.
Who are sleep aligned.
Wow. So a sleep-aligned dentist. So get a sleep-aligned dentist. We know who they are, and then can give you a mandibular advancement device. It just cranks your lower jaw forward a few millimeters to prevent your lower jaw from falling. And then what we do as surgeons is take you to theater, diagnose where the obstruction is coming from using that, what we've just called the procedure called a DICE, and then operate. And the question is, what are we doing?
What are you operating on?
Remember, it's real estate.
Yeah.
How much real estate is there? So either remove excess tissues, okay, there are many procedures for that, or stiffen. Remember, it's vibration. So stiffen these vibrating structures.
Like stiffen your throat?
Stiffen, all that is done from inside the mouth.
Okay.
Yeah, so there are no external incisions, okay? So stiffen the structures inside the throat. Or nasal surgery. You know what? Remember what we talked about, Latif? You have a deviated nose, so septoplasty. You have enlarged tabinets, so trim your tabinets. You have sinuses or congestion, sort out sinus surgery. For children, remove tonsils and adenoids. So it's very straightforward. About 20, remember sleep apnea is new in the world. It's about maybe 30 years old. So right now we have about maybe 28 different surgeries that we can do. Wow. Yeah. So remember I said precision medicine.
Yes.
Yeah. And
It's important. Are the devices fairly accessible and affordable?
So that goes now to the crux of this. Because sleep has been labeled a lifestyle disease, our work for those of us who work in the sleep space and sleep medicine, our work is to lobby insurances and governments that this is not just a lifestyle problem. This is also it's not just a sleep quality problem. We are not bringing marital harmony. This is affecting people's daily lives.
Right.
We have cardiac events, lethal cardiac events. We have metabolic problems going on. We have body-wide issues because sleep affects the rest of the body. Okay, and we have these patients coming in, and it's affecting your bottom line as insurance companies when you're not diagnosing these patients. So my ask is that we need to move away from the mindset that it's lifestyle, that it's a nuisance, to a medical condition, and that there's treatment available for it, and it is being done here.
Wait, let me ask you, if we improved the sleep pattern of our population, would that reduce the burden of our healthcare?
Yes, because we do this every night.
Okay.
You know, we forget we sleep every single night.
Yeah.
Of course, everyone comes and asks me how much is good sleep and all that stuff. There are a whole number of answers to that, but usually we just say 6 to 8 hours. The simple question. But when your sleep is disrupted every night, you can already see the consequences daily.
Yep.
Yes.
Yeah.
Okay.
I
So
want to come back into that one where it's lobbying. How far have you gone in this lobbying? Look, the health sector in this country, apart from the politicians, is headed by professionals. The Director General of Health is a doctor. The directors in the various departments of the Ministry of Health are doctors. And even many of these insurance companies, they will deal with doctors. They will talk to doctors who will say, so this is the cost of this and so on and so forth. So it should not be a difficult thing to actually convince a doctor that sleep apnea is
it's not a lifestyle disease. Yeah.
So the problem, so let me say it in two ways. There's the lay public and the medical fraternity. My work, or rather our work as doctors, especially ENT surgeons, or those of us who deal with obstructive sleep apnea, because unfortunately sleep doesn't have a home. the heart belongs to cardiologists,
The brain to neurologists.
the brain to neurologists, the bones to orthopedic surgeons. Sleep doesn't have a home yet. Okay, so we expect in the next couple of years we might have now dedicated sleep specialists. Okay, so we don't yet have that as a category.
Yeah.
So it belongs to a lot of different people. So to answer your question, number one is to bring awareness to the lay public.
Yes.
Number two, to link all these different ways that it presents, because it presents to the cardiologist as untreated hypertension. It presents to the physician as difficult to treat diabetes. It presents to the urologist as a patient who wakes up to go to urinate. It presents to the psychiatrist as fatigue or difficulty, attention problems or depression.
Yeah.
Okay. It presents to the wife as marital disharmony. You get? There's something we call sleep divorce, where you sleep in different bedrooms just because of the snoring. You get? So my work is therefore to try and relate and say all these things. We are looking at the elephant differently. You are touching the tusks. You are touching the tail. You are touching the trunks, but we're all dealing with the same problem. So that is our work as for those of us who work in sleep medicine.
Yeah.
Okay.
This is so fascinating.
It is,
I wanted
yes,
to ask you. Sorry, Ma.
No.
It's like, can
I've
I?
been holding on to.
I'm so
Okay, no,
sorry.
go,
It's very quick. It's just what has your work taught you about how people underestimate sleep?
We come only when there's a problem, and that problem is every single day. And no one understands because you sleep alone, or there's disharmony and it's wrecking your marriage, or it's actually affecting your work. Because I get a lot of, what do you call them, high executives who even a 5% dip is important for them. And they're like, Doc, I'm in meetings and I'm yawning at 10 o'clock because of EDS, excessive daytime sleepiness. So they come to our center, the sleep center, and they're like, I'm off.
Okay.
You know, so so to answer your question, it's underestimated, it's underdiagnosed, and it's new. When you Google, you'll find sleep apnea is new. And so no one knows about it. Then number 3, everyone is using their watch to diagnose their sleep. They're using Google, AI, so then there's a rise. So we expect a surge of these things.
Okay.
Yeah.
No, just the Kikombe was, and this is a little bit on what you were saying about how we think of sleep. But he says, me, the thunderstorm coming from my throat, watch it too. I know I do this after a wine or when tired. And he spoke to exhaustion and alcohol. And then he says, in our days, sesaflies used to cause sleeping sickness. It was prevalent in Kenya. I wonder how that looks like now. We used to judge kids in class in the afternoons after maziwa ya nyayo. And that's the excessive daytime sleepiness. You know, what's excessive daytime sleepiness? But I also wanted to know, just, you talked a little bit about sleep hygiene. Outside of sleep apnea, what is good sleep hygiene from a more holistic perspective, a more lifestyle perspective? Okay.
So sleep hygiene is how you wind down. These things, our phones, are one of our biggest enemies. You know, they keep you awake. They keep your mind awake. Number 2, our mind is also our biggest enemy. Your mind races. You want to do your strategies just when you're going to sleep, you know.
Suddenly, everything is just coming.
Exactly.
Suddenly, everything, yeah.
And then we forget about our environment, our direct environment. You're not going to sleep with these lights on in the studio. And there's some people with loud noise. And I think we've been going through that. I think it was 2 years ago when a lot of nightclubs were in not social places, but residential places. So you think about all those things. It's basically your environment, your mind, and your behavior. What things can actually help you wind down.
Okay.
Yeah.
Somebody's telling me, I think you mentioned it, but maybe they just want to hear it. Ask the doctor about perimenopause insomnia.
So remember I said women are protected, and God bless them. However, around perimenopause, that protection goes down. Some of the hormones change, okay, and they reduce. And it affects your sleep. And actually, you'll find a lot of insomnia, a lot of sleep apnea now starts presenting itself, okay? And then, of course, they're a bit shy about it because this has been labeled a male disease. So you'll find slim women. Remember the typical
Give us
the male, large,
obese
elderly. So you get these slim ladies who are very worried. They're like, hey, doc, I'm snoring. Or you get the slim guy as well, because that's what's happening these days. Hi, doc, my wife is telling me we have a new child. The child is causing the wife to wake up, and also you can imagine. Yes.
One battle after another.
One battle and another. So, but basically, I think the bottom line is it can be diagnosed, it can be tested, and it can be treated. Okay? Go to your ENT surgeon or to your ENT physician. We also have the Sleep Diagnostic Center. You can Google that. That should be able to sort you out. And let's get sleep apnea sorted out.
Naweza kuja kwako na sha?
Unfortunately, SHA hasn't yet recognized the sleep apnea. But remember, as doctors, there's one word that we learn only after medicine. It's called lobbying. So it's something that we're not taught in school, but we see the problems in the community. So that is on us to lobby the government, insurances, and everyone else who holds the purse strings. That this problem is there and can be sorted out.
Thank you so much. Very insightful. Dr. Ian Macharia has been our guest for this last hour. He is an ENT surgeon talking about snoring as a health risk. In the next hour, we're hosting Laxmana Kipto, Director General, CEO, Public Benefit Organizations Regulatory Authority, or PBORA. PBO, the new face of NGOs. That's the conversation coming up next. It's coming up to 8 a.m.